The Joint Task Force, in collaboration with Clemson Bioengineering and GHS, present the Voyager. Total knee replacements is one of the most popular orthopedic surgeries in the U.S., with 700,000 replacements performed in 2016. This number is projected to increase to 3.48 million in 2030, which accounts for a whopping 500% increase. This huge increase in surgeries performed also means an increase in surgical complications, which must be addressed as they increase the cost of these operations, the time it takes to perform the surgeries, and the chance of litigation for the physician or hospital. Most of these complications revolve around the tibial resection. Let's review why this is the case.
So, being a attending surgeon at a institution where we have training residents and fellows, I think it's very important, very helpful to have a device which will protect some of the important structures around the knee, particularly the medial collateral ligament, the lateral collateral ligament, the popliteal artery, the posterior cruciate ligament.
The tibia is typically what we worry most about in surgery, because there's a lot of ligaments and arteries in the back of the knee that can be compromised. For instance, injure their artery, they can ultimately lose their leg. And if you injure one of the ligaments, such as the lateral collateral ligament or the medial collateral ligament, you would need to move to a much bigger, more expensive prosthesis that may not last as long.
The Voyager is the most novel device on the market today, focused on protecting the soft tissue around the tibia during the tibial resection step of TKAs. Utilizing a retractor-style approach, the Voyager provides a barrier around the tibia so that the saw blade does not come in contact with any ligaments or vasculature. The Voyager utilizes a blade retractor design for the MCL and LCL retractors, as well as a two-prong design for the PCL retractor. Each retractor is adjusted using T-slots to allow the Voyager to fit different sized tibias. The latch system allows the Voyager to be compatible with current extramedullary alignment guides, and the pinholes at the top of the base allow for fixation pins to be inserted for extra stability.
As a fellow in total joint replacement, I thought this device was excellent. I think what it provides is the ability to protect all the structures that we want to protect, but at the same time it was relatively easy to use.
We have adjustability both medially, laterally, as well as rotationally. And we also have the ability to adjust anterior posteriorly. I think in our trials of the device, we very nicely protect the MCL as well as the lateral collateral as well as the patellar tendon.
In conclusion, the Voyager is a novel, easy-to-use device that gives surgeons the ability to resect the tibia during TKA while protecting ligaments and vasculature. This will allow surgeons to avoid potential complications, potential litigation, and could ultimately save lives.